Hello, everybody. Today we're talking about the Prostate Cancer Express train, and this train is a survivor's blueprint to diagnosis. Not that it really is a quick train, but it's to keep you on track. So, what we're going to talk about next is the men that actually are getting this, 1 in 8. This is one ticket that really nobody wants, but we get it. 1 in 8 men, 3.5 million men are navigating the prostate cancer in the United States. Lots of men are getting treated at the same time. This is the 3.5 million men that are getting treated. There are a lot of people that don't even know they have it, and for them maybe it's not a big deal. It depends what their age is. And if you've read the book, this is the part where I talk about the cluster and all of the crap that's going on in a very small place. And that little thing called a prostate, which looks like the size of a walnut, but really it keeps getting bigger, more like the size of a grapefruit for some men. So yeah, we're defining the enemy of the prostate, which is the BPH, localized adenocarcinoma, and possibly metastatic cancer. So those are the things and I've seen a lot of people with prostate cancer, and nobody's is the same. So really it's hard to compare yourself to anybody else, no matter what grade. Yeah, this is one of the reasons we go to meetings, because no one's cancer is the same. 10 different people, 10 different kinds of cancer and how it grows. Any kind of surgery or treatment for prostate cancer, look at them carefully, because they all have something. They're never going to be perfect, and neither will you be, but you'll be better. If you get nothing out of what I said today, nothing else, get hope. Because most men that take care of this will live through it. Believe it. And then here are just a few treatment options, and active surveillance, surgery, radiation, hormone therapy, vocal therapies. But as you'll learn, each thing has its own side effect, and so the reason we're doing a 30-day holiday of an orgasm is to, before you do any kind of surgery, robotic surgery, radiation, anything that you decide to do, give yourself 30 days, number one, before you make a decision. Number two, do it every day. Have an orgasm a day for 30 days, just to give yourself a memory of what it was like to do it, and not worry about any other problems along the way. Because believe me, you're going to miss the days that you weren't able to do it. And maybe you'll be able to keep these in your memory bank, and also go back to the times that you were able to do it when you were younger, and enjoy that. Energy beams and the chemical cliff. So a lot of times, if you are going to do surgery, be careful. If you have anxiety or depression issues, they will want to give you something called Lupron or other medications. For some people, it will create havoc in your life, because you cannot lower the testosterone without lowering everything else in your body, and also the chemicals that make you feel good and that actually give you an erection. So watch for that and learn how to deal with it as you can. You may need antidepressants for that, especially if you're prone to depression. And then you have to really think about the 14-week primal connection. I mean, our connection to sexual identity is hard-coded into our nervous system, and it's done at 14 weeks. Did you know that? Because if you didn't, that's why you feel bad after getting it done. And don't think it's going to be perfect after you get the surgery, because if you get the surgery, you have to understand your bladder is weak, your body's trying to adjust, you're going to leak, dribble, flood out, whatever. Get used to it, take your time, everyone heals in their own. And this idea of pelvic floor and Kegels, they'll give you a paper or a sheet about it. A lot of the times you have to do your own research, find a physical therapist that can do it for you or help you do it, learn to do it the correct way. But there is no, perfect way to do this. You'll do it in your own time and space, and everyone will heal differently and have a different level of endpoint. Take your time, do what you can in a day, and then leave the rest for tomorrow. And then there's the new normal of intimacy, whatever that is for you. None of us have the same things that we do every day, and it's going to change. Be open to all of it, and your life can get better. It's all about rebalancing and reconnecting. And it really is your responsibility to make sure things go the way you want it to. It's not perfect, but it'll be the new you, whatever that is. The nutrition. You need to figure out how to eat better plant-based foods, healthy, lean fats, and protein. It's just some of the basics that we have to do to help us heal. And the rewiring of the nervous system. I mean, we really need to learn how to use everything that we have. And I'm talking about dark humor, the habening, how to get the oxytocin going by just hugging. Whatever it is that you need to do, I put all the information in the book, and